Hi, my name is Amy Nichols-Belo, and I'm an associate professor of global health studies and anthropology here at Mercer University. I've developed a 3-segment series on demystifying the IRB that's largely targeted for people that haven't done human subjects research before, or who aren't sure if the research that they're doing involves human subjects. So I'm going to talk through the series in a few minutes, but I just wanted to introduce myself. I'm trained as an anthropologist, and I have, as a person who works with humans, been doing human subjects research for more than 2 decades. And I've worked with IRBs at several institutions. And one of the things I realized when I came to Mercer about 6 years ago was that, particularly with our research that reaches out mission, we often are doing things that are human subjects research, even if we weren't necessarily trained in those areas. So what I want to do is talk through the 3 segments, and I want to point out that you don't have to watch all 3. You're welcome to jump in depending on which segments are more relevant for you. So this is the first segment, and it's basically just an introduction to the IRB and human subjects and a few kind of overview issues. The second segment, IRB for the Teacher Scholar, brings up several case studies, including several from my own work, that help you to think about how your role as a teacher scholar might be impacted by IRB issues. And then the third section is really designed as a kind of tutorial to share with you the Mercer IRB process. Now, importantly, this series is not designed to take the place of any of the excellent information available on Mercer's Office of Research Compliance website, or to take the place of City Training, which is a national training program that Mercer subscribes to that trains students and faculty in ethical research practices. This is designed more as a kind of introduction to the IRB, and really what I'm hoping to do is to help you understand why the IRB is important to your work as a teacher scholar. So what is the IRB and why should I care? So I just wanted to provide a little bit of background about IRBs. IRB stands for Institutional Review Board, and what IRBs do is monitor human subjects research to make sure that it's complying with federal ethical guidelines, and just to make sure that we're doing the best that we can for our human subjects. So in a few minutes, I'm going to be actually offering you a definition of human subjects, but I want to tell you that IRBs have been around since 1974. They were introduced as part of the National Research Act, which has been strengthened several times since. And initially, they were established to provide oversight to biomedical and behavioral science research. And I think this is one of the reasons why sometimes people are confused about why they need IRB approval. For example, if you come from a discipline that is neither biomedical nor behavioral science, you might think, well, my work doesn't exactly fit this definition. Do I need IRB approval? Should I seek IRB approval? And of course, one of the things that makes Mercer unique is so many of us are doing interventions in the community. So many of us are doing engaged scholarship in the community. So much of us are doing things that fit the research that reaches out mission. And much of that work, whether domestic or abroad, requires IRB approval. But again, because we are a place that really emphasizes interdisciplinary work and transdisciplinary work, not everybody who's doing these kind of engaged projects has training in human subjects research methodologies. So my point here is just to say that a lot of times we think about the IRB as a hoop, as something that we have to get through, or something that we might want to try and avoid at all costs. The Mercer IRB is actually a really, really generous IRB, and an IRB that's really willing to work with faculty and students. That's, of course, the second piece, is that while you yourself may not be a researcher that deals with human subjects, perhaps you're supervising an honors project where students might be doing interviews or focus groups or surveys, and as the advising faculty member, you yourself should be familiar with the IRB process. So the first thing I wanted to do was explain what a human subject is. And I'm not going to read you this long and lengthy description, but I think it's important to understand a couple of key words. So first of all, human subjects are living individuals, and they're individuals from whom we, students or faculty, obtain information or biospecimens. And so I think most of us understand that if you're collecting biospecimens, hair or fingernail clippings or something like that from a human, you probably need ethical oversight. But a lot of times this intervention or interaction piece confuses folks. So intervention or interaction could be something like walking around downtown Macon and asking people questions with a clipboard. That, from the IRB's perspective, is interaction. Intervention is doing something to people, and that might be deceptive. That's one of the protected areas of IRB approval, but it might also be something like randomizing one group of students, your own students, to receive a particular new teaching methodology and having the other group of students not get it. That would also constitute intervention. So intervention is doing things to people, and interaction is interacting with people through any number of means, including things like interviews and surveys. So human subjects are not just people who are subject to biomedical experiments, but might include your students, and might include people that your students interact with as part of a class project that you're having them carry out. Importantly, in the IRB world, there are special concerns for pregnant women, human fetuses and neonates. Most of us are not doing work in that area. Children, cognitively impaired people, prisoners, students and employees. That's obviously really important for us. And then economically or educationally disadvantaged individuals. So much of our work might involve those groups. We might be creating a project in the community that we think of as a service learning project that works with educationally or economically disadvantaged individuals, but we're not thinking about how our work might have ethical dimensions. So one of the most important things to understand about the IRB is a double check on your own thinking. So when I think about research projects that I've taken on, I try really hard to think through all of the ethical dimensions, but I appreciate the double check of having the Mercer Office of Research and Compliance providing a review of my work to make sure that I haven't missed something, or that I haven't missed the any implications, ethical implications of my students' work. So the way that I like to think about this is that there's a sort of a two-step process to determine whether or not you need IRB approval. Will you or your students be talking to or surveying other humans? Again, I'm assuming that if you are doing a data collection process that involves biomedical materials, you probably have already thought through these issues. Similarly, if you're doing an experiment, I presume that you probably already thought through these issues. But for the rest of us, will you or your students be talking to or surveying other humans? And if so, are you or your students planning on sharing this work? So again, if you're just planning on talking to people to get some background information, and you're not planning on writing it up or presenting it at a conference or presenting it in a forum, a public forum or something like that, you may not need IRB approval. But if you're planning on doing this work and sharing it, then you have sort of gone beyond just a small scale in-class project. Mercer IRB has a more technical definition here, which is you need IRB review if the project is research, and then research, I've got the definition below, and directly involves human subjects or their private or identifiable information. And so here research is contributing to generalizable knowledge and its systematic investigation. That's the official definition according to the federal government. But the Mercer IRB continues by saying contributing to generalizable knowledge is something like presenting at Bear Day, publishing an article, sharing information at a conference. So from the perspective of the IRB and for me, I think anytime that we are engaging in testing, evaluation, research types of modes of inquiry, and we're sharing that information, we should seek IRB approval. So there are actually three kinds of IRB approval, and elsewhere they're called they're called full board, expedited, and exempt. At Mercer, we really divide them into exempt, minimal risk, and clinical trials. Again, I'm not going to be talking about the clinical trials process at all. Presumably, if you are a person that engages in clinical trials, you are well aware of the work you need to be doing. So I'm going to talk mostly about minimal risk. And so minimal risk applications are going to be the focus of the third segment of this three-part series. So there are several categories that the federal government has determined are exempt and don't require IRB approval. Obviously, if you're not doing research with human subjects, and again, you can refer to that definition, then you don't need to submit IRB approval. That seems pretty obvious. And then there are these four categories that are considered to be exempt. So I'm going to come back to number 2 because that's the one that I think gives people the most trouble. So if you're doing an activity in support of Homeland Security, you don't have to seek IRB approval. If you are doing a criminal justice investigation or public health surveillance, you don't need IRB approval. So let's take the public health surveillance example. If you are collecting nasal swabs to determine the prevalence of COVID-19 in a community, and you're trying to determine what percentage of people in Macon, Georgia have been exposed to, are currently infected with COVID-19, you don't need IRB approval. However, if you were doing a research project where you were interviewing people about how they're preventing COVID-19, you would need IRB approval. So one is a surveillance activity, the other is research, particularly if you're planning on publishing your study in a journal or presenting at a conference. So here's where number 2 gets a little bit tricky. So the reason why journalism is exempt, even though of course journalists talk to humans, is that it frankly would be completely impossible for journalists to work at the speed that they need to report a story if they had to seek IRB approval. And so this is actually sometimes complicated when we're doing an interdisciplinary project where one field is an IRB discipline and another field is, let's say, journalism. In this case, if it's not an urgent study, I would strongly suggest that in that collaborative work, you seek IRB approval. The IRB may decide that you're exempt, but that's their decision to make as the ethical review board for the institution. Okay, so similarly, oral historians. Some oral historians have said, no, we're doing humanities work, we are exempt. But I know other oral historians who say, well, what's the problem with getting IRB, particularly if I'm doing oral history in a community that has a history of oppression or injustice, a community that may have been taken advantage of in the past. Why would I avoid getting IRB approval when perhaps it's going to, allow me to have additional ethical oversight? So my discipline is anthropology, and anthropologists, some have fallen into the argument of making the claims that their scholarship is more like oral history and that they don't require IRB approval, whereas other anthropologists like myself believe that it's really important to protect our human subjects, and again, to have that external ethical oversight. Again, the IRB is not trying to prevent research. The IRB is trying to ensure that we think about human subjects and the undue burden of research before we work with people. In other words, if the same group of people has been interviewed over and over and over and over and over again, that begins to become a kind of undue burden for that population. And that's one of the reasons why, for example, prisoners are protected, is that in the past, prisoners were considered sort of a captive audience, a literally captive audience of people who could be experimented on or who were subject to kind of undue scrutiny. Again, a person doing scholarly research on imprisonment might have a very good reason for working with prisoners, but if you're just sort of treating prisoners as your captive audience, then that's of course not appropriate, right? So what I would argue is that even if you think of yourself as being from an exempt discipline, you're doing work that you don't think is exempt, it's still easier to reach out to the Mercer Office of Research Compliance, the ORC, and ask them for insights. Again, there's no sort of problem with putting in a proposal and then having them declare it exempt afterwards. So here's my kind of pitch to those of you who come from disciplines that don't do the IRB. And again, there's a wide range of disciplines that don't think of themselves as IRB disciplines. Many folks who work in business don't think about marketing research, for example, as meeting IRB approval, or folks in the humanities who aren't accustomed to seeking IRB approval. It really doesn't matter what your disciplinary training is, it matters on the project. So if the project, again, is going to involve collecting information or specimens from humans, and then presenting that data, then you have met the kind of litmus test for IRB approval. So you might be, for example, collecting a whole bunch of narratives from individuals, and then creating a book that sort of details those narratives. What you've done by some standards is human subjects research. You're collecting information, and then you're producing a document that can be more widely read. The other thing that a lot of people sort of misunderstand is that the IRB isn't just about domestic work or work happening on campus. It's also important to get IRB approval before doing international work. And I'll be honest, I don't think that's happening very often because there's sort of nowhere on our IRB forms to talk about international research. But I myself have put in multiple IRBs for Mercer on Mission projects that I've been involved in, for my own scholarly endeavors as an anthropologist, and have helped students who are doing international research. So it's important to then think through those kind of two things. Am I collecting human subjects information? Am I planning on presenting it? Is my student collecting human subjects information? Is he or she planning on presenting it? So that concludes the first of the 3 segments, and I'm going to go ahead and move to the second one.